Good afternoon. My name is Jane Eng, and I am the President and CEO of the Charles B. Wang Community Health Center. It is my pleasure to welcome all of you, and especially Mayor Bill de Blasio and First Lady Chirlane McCray, to the Health Center. "46 years ago, a group of young, idealistic activists had the idea of organizing a health fair to provide health education and health screening to the medically underserved Chinese community in Manhattan's Chinatown. The health fair lasted for 10 days, and part of Mott Street, the main street of Chinatown, was closed for the event. From the health fair came the idea that Chinese Americans and others could best be served by a health center owned and operated by the community. The Charles B. Wang Community Health Center has grown dramatically since then. We now have 5 locations in 2 boroughs and serve 55,000 patients a year. We provide more than 250,000 medical and dental visits a year, including internal medicine, pediatrics, OBGYN, mental health, health education, and social services. Our services are linguistically and culturally appropriate. The health center provides services to patients regardless of their ability to pay. We are proud to be an anchor employer in the community, providing job opportunities for community members. As shown by epidemiologists at the New York City Health Department, cancer is now the leading cause of death among Chinese Americans, and lung cancer is the #1 cancer among Chinese Americans. Lung cancer caused by smoking. So we, at the Charles B. Wang Community Health Center, have embarked on a smoking cessation program, and we need to expand primary care services in the community. In addition, there is a great need for mental health services among Chinese-speaking New Yorkers. According to the New York City Health Department data, suicide is the 9th leading cause of death among Chinese Americans. Suicide does not hit the top 10 for whites, blacks, Hispanics, and other ethnic groups. To meet the growing need for mental health services, more than 15 years ago, the Health Center pioneered the Mental Health Bridge program. We believe that mental health services are best provided by integrating them into a primary care setting. There are many residents of Flushing who still lack access to affordable primary care services, particularly mental health and dental services. We appreciate all of the support from New York State and New York City elected officials, including Mayor de Blasio, Queensborough President Melinda Katz, New York State Assembly Member Ron Kim, New York State Assembly Member Nili Rossick, New York State Senator Toby Ann Stavisky, Council Member Peter Koo, Council Member Margaret Chin, Council Member Corey Johnson, City Council Member Paul Vallone, and all the other government officials at the city, state, and federal level who have supported us. At this time, I am pleased to introduce Stephanie Cheng. Stephanie is a longtime patient of the Charles B. Wang Community Health Center, and we have been honored to have her serve on the Health Center's Board of Directors for the past 3 years. Stephanie?
Good morning, everyone. Thank you. My name is Stephanie Chang, and I'm a patient here at the Charles B. Wang Community Health Center. I am so thrilled to be here today to share my story. The Charles B. Wang Community Health Center has a special place in my heart. I've been getting health care here since I was a baby, and the health center is the primary care provider for my entire family, including my great-grandmother, who used to get her care right here at the Flushing site when she was alive. In my family, we understand how critical access to health care is. Growing up in China, my grandmother's father died suddenly without access to a doctor. Like many immigrants who come to the United States, when she came to New York, she did not have insurance, and she did not have many options to getting health care in Flushing. However, many new immigrants knew of the health center and spoke highly of the care they received here. It was through word of mouth that my grandmother found the Charles B. Wang Community Health Center, and when I was born, my grandmother started taking us here for our care as well. As a Chinese immigrant, the health center catered to my grandma with providers who were not only able to speak to her in Chinese, but able to speak to her needs and challenges as an immigrant trying to navigate our complex health system. The health center has helped countless people take a more active role in their own health and the health of their loved ones. Through the years, the Charles B. Wang Community Health Center has provided resources far beyond basic care. Not only did we come for our annual checkup, but they also provided resources to help my dad quit smoking, metro cards to get to and from the health center, and mental health services for my family members. Mental illness runs in my family. A close family member confided in me of her struggle with mental illness. She said, "Stephanie, I'd rather lose an arm and a leg than have this disease, because not having control of your own mind is the worst type of illness." I've seen firsthand how the health center's mental health practitioners have helped my family in so many ways. This health center is not just a provider of comprehensive care, but a cornerstone of our community. And with that, I'd like to introduce someone who has been a fierce advocate for healthcare for all New Yorkers and federally qualified health centers like this one. New York City's First Lady, Chirlane McCray, created Thrive NYC, the most comprehensive mental health plan of any city or state in the nation, and she is recognized nationally as a powerful champion for mental health reform. Please help me give a warm welcome to New York City's First Lady, Chirlane McCray.
Thank you, Stephanie. Thank you for sharing your story. And I hope today marks the beginning of many, many more wonderful families like yours getting the care and the support they need to be healthy and well over the course of many generations. It's good to be back here in Flushing. I used to live here in the late 70s for a few years, and it is just really good to be back here again. I want to thank you, Jane, and your team for hosting us here today. And thank all of you for joining us. What a great day this is. I'm glad to have this moment with everyone to celebrate a great example of how New York City can move forward, how our city continues to push ahead, even as challenges are looming. Because these are troubling times, these are challenging times. People all over the country are watching Washington, D.C., watching what's happening with the healthcare debate, and they're worried. They're worried and they're afraid, and they don't know if they'll lose the coverage that their families depend on. They don't know if they'll be able to manage their diabetes, or pay for their counseling service, or pay for substance use treatment. They don't know how they'll get by. So it's especially heartening to be here with all of you, people who fight so hard to make sure that all New Yorkers can get the care that they need. The Charles B. Wang Community Health Center has been providing quality health care for nearly 50 years, serving people like Stephanie, her family, and tens of thousands of others. They make New York City proud. As New Yorkers, we believe people shouldn't have to be afraid. They shouldn't have to empty their bank accounts when they get sick, and no matter how they came to our country and our city, people shouldn't have to live in the shadows, especially when it comes to health care. Those are our values, and community health centers like Charles B. Wang give meaning to those values every day in the neighborhoods where they're needed the most. And we want to help them reach even more people. So today, I am excited to announce that the Charles B. Wang Community Health Center will be expanding with the creation of a brand new Healthview Community Health Center right here in Flushing. The city is proud to join Queensborough President Melinda Katz, the City Council, the Chinatown Health Clinic Foundation, the Charles B. Wang Community Health Center Board of Directors, and other partners in supporting the new center through the Mayor's Caring Neighborhoods Initiative, with the leadership of the New York City Economic Development Corporation. Healthview will continue a rich tradition of serving the people of Flushing with holistic and culturally competent care. When it's fully up and running, more than 25,000 patients will be able to rely on Healthview for their most basic healthcare needs, from primary care and dental checkups to pediatric care and women's health services. And everyone will get treated regardless of their ability to pay or their immigration status. I am especially thrilled that in keeping with the goals of Thrive NYC, the new center will provide mental health services to the people of Queens, including screenings for depression and other illnesses, individual and group therapies, and a wide range of treatment options. And New Yorkers will be able to speak with providers in Mandarin and Cantonese, Korean, as well as English. Because no one should have to struggle to communicate. No one should have to communicate when talking about, or struggle to communicate when talking about their own health and well-being. Community health centers like HealthView are critical to serving New Yorkers well. We are at our best when people can get services right in their communities. So think about it. The people are surrounded by their family members and neighbors. They feel safer, they feel more supported and most comfortable. And that's how everyone should feel as they take care of themselves and their families, especially when in pain, suffering, or when people feel most vulnerable. We shouldn't make getting well any more challenging than it already is. Days like this make me incredibly proud to be a New Yorker. So many people came together to make this happen, and so many more will work over the coming months and years to achieve our vision. What a stark contrast it is to what is going on in Washington with Congress members trying to make it more difficult for people to manage their health. And with so much focus on maximizing tax cuts for those who have plenty of money and plenty of options to manage their care, President Trump and most of the Republicans in Congress are practicing a cruel kind of politics of fear and cold indifference to people's lives. The only way we can counter that is by showing what we stand for, what we value. So as the Senate continues to play political games with the health and well-being of all New Yorkers, I want you to know that all of us in city government are fighting for you. And no one fights harder than the man by my side. Ladies and gentlemen, please welcome our Mayor, Bill de Blasio.
Thank you. So, it is really a pleasure to be here for several reasons. First, I want to join Chirlane in giving you my Flushing bona fides that I lived for 2 years on Saul Street, right by the Botanical Garden. It was my bachelor years, I say, before I met Chirlane. And an amazing neighborhood to be a part of, and it is great to be back. This is one of the most vibrant and extraordinary neighborhoods of New York City. And we celebrate today the way we do things in New York City, the way we do things in Queens, the way we keep reaching people who need help, regardless of what's happening in Washington, D.C. Chirlane's absolutely right. This is a study in contrast today. We're celebrating that more people will be getting health care. We're celebrating that health care will be easier for people in the Flushing community and Queens to get because of this new facility. While literally over these weeks in Washington, people have been talking about how to take health care away from millions and millions of Americans. And while we continue to fight battles in Washington, I fundamentally believe the answer is to keep showing what things should be, to keep being a beacon here in this city of the way that we want to see a fair society created, to keep being the antidote. It's something we and other cities around the country have ample opportunity to do while these fights play out in Washington. Keep getting help to people who need it, keep creating a more inclusive and just society. That's what we celebrate today. I want to thank Chirlane for her extraordinary work, and I was very touched by Stephanie's story. So first of all, Stephanie, thank you for all you're doing, but thank you for being so open about the challenges your family has faced, because just that very act of speaking about your personal story helps other people to be more comfortable to come forward and get the help they need. So let's thank Stephanie for her leadership. And I want to thank my wife, because what Chirlane has done as our First Lady is made it easier for Stephanie and millions of New Yorkers to feel more comfortable talking about their mental health challenges and seeking the help they need. And I want to emphasize, this is something that it should be easy if you've got a challenge to be able to talk about and seek help, but we understand the stigma that's being created in our society, and we understand how it stands in the way of solving people's problems. And for some people, that manifests in really big challenges down the road, whether it's homelessness or incarceration or so many things that could tear a family apart. So getting people to come out in the open, talk about mental health challenges, and then get help more easily than ever before, that's what our First Lady has devoted herself to. Let's thank Chirlane McCray for all she has done. I also want to thank, this is a day to celebrate. I want to commend Jane Eng, the CEO of Charles B. Wang Health Center, for all that you have achieved. Congratulations to you and all of your colleagues. And the Economic Development Corporation of Cities is going to be a big partner in this effort. Let's thank the president of EDC, James Patchett. So think about it. Charles B. Wang originally had a concept of making sure that communities could get health care, that people would not be deprived of health care because of the language they spoke, because they were immigrants, because they didn't have a lot of money. Such a foundational idea that if people couldn't access health care, nothing else could work in their life. And so here, things started to change. And Jane, I appreciated your story about how the humble origins of this idea and then how it took flight and became so important to so many people. This new facility is going to allow us to reach so many more people. And we know every day in this city, there are still so many people uninsured, separate from what's happening in Washington. We know the challenge we have right up front. 500,000 undocumented folks who don't have access to insurance of any kind because they're undocumented. Another 500,000 people who are eligible for insurance under the Affordable Care Act and still don't have insurance. And we've been fighting every day to make sure we make that insurance more readily available to them. It's 1 million people. And then there's lots of people who have insurance but still don't feel it's easy to access health care. There's maybe geography or a language barrier, or they just don't understand how important it is to get care early before a problem develops into something bigger. And so when you make healthcare more accessible to people, when it is at the grassroots, when it's available, when it's easy to reach, when it's in your language, people get healthier. It's the whole concept of this place, and that's why this expansion is so important. We're proud to be partners. And we know this is going to do a lot of good for the people of Flushing and the people of Queens in general. And this is the example we want to see more and more of. The more health care available and the closer it is to the grassroots, the better. And the contrast to what's happened in Washington these last few weeks is so stark. Now, we all know that this health care bill in Washington, this is one of the ultimate moving targets we've seen in a long time. Literally, this morning, we were all digesting the news that 2 more Republican senators said they would not vote for a motion to proceed. And then the Senate leader came up with a new idea to immediately repeal the Affordable Care Act. And then just minutes ago, we heard that 3 different senators had come forward and said very clearly that they would not support that. I want everyone to appreciate that all over this country, literally millions of people have raised their voices in the last few months in favor of protecting health care for all. The Affordable Care Act used to not be sufficiently popular despite all the good it was doing. Now, the Affordable Care Act is supported by a majority of Americans. And more people think the efforts to repeal it are both unfair and ineffective, but also motivated by the wrong political view, and they want a better solution. I want everyone to understand that fight's going to continue to rage. There is, unfortunately, at this hour, despite the changes, literally 2 major shifts that have occurred in the last 24 hours, we have to remain vigilant. No one who cares about health care should be resting on their laurels right now. No one should be popping any champagne bottle corks right now. We got to be clear, this is still a very live situation in Washington. There's a lot of people in Washington who are trying to destroy the Affordable Care Act, and this ballgame ain't over. So we're going to continue to work with allies all over New York and all over the country, particularly with fellow mayors, to make sure that any new effort to reduce health care for people around the country gets beaten back. So today there is some progress, but there's no reason to think this fight is over. I want to emphasize that. And everyone who cares should stay tuned and be ready to pick up the phone and reach out to your friends and allies all over the country. Keep them involved. In the meantime, we have a lot to celebrate today and a great example to show our fellow New Yorkers. So many more people are going to get the care they deserve. And now it's my pleasure to bring someone up who can epitomize the difference between having access to care and not having it. I mentioned that we made a major new effort to get more people insured, because as I said, there's about 500,000 New Yorkers who could get insurance right now. Affordable Care Act is the law of the land right now. We started a strong initiative, grassroots initiative called Get Covered NYC, to reach people and make sure that if they were eligible and they were willing, that we get them signed up for themselves and their family for life insurance, for health insurance. And for so many people, that meant the difference between being able to get care, knowing care was out there, knowing they could afford it, or the tragic reality that's been true for too many New Yorkers, not going to a doctor because they knew there was no way they could possibly afford it. We want those days to be behind us. So someone who has a good news story from his own life is going to tell us about it now. It's my pleasure to introduce Joseph Bagno.
Good afternoon, ladies and gentlemen. My name is Joseph Banjo, and I'm a proud New Yorker. I'm an unemployed immigrant. I'm here today because I'm very angry that President Trump and congressional Republicans are trying to take healthcare away from New Yorkers. I know how important it is to have access to healthcare. For a long time, I didn't have health insurance. I didn't have a serious illness, but I worried. I worried about whether I could be sure that I was healthy. I worried about how I would pay my rent, keep food on the table if I ever got sick. And I worried about my fellow New Yorkers who already were sick and didn't have any way to get healthy. Thanks to the mayor's efforts, through Get Covered NYC, a commendable life-saving initiative. Well, for a while too, my wife had an issue with her hip and couldn't get health care, but through Get Covered NYC, we were lucky to have that, and now she's sure that she can get treated, and she's being treated. Now that I have health insurance, I know that I am well, and I know that if I get sick, I will be able to get better. Everyone deserves to know that. President Trump and Republicans in Congress want to take that away from me and from other New Yorkers. If Republicans in Congress get their way, people will die. They will die avoidable deaths. People will be killed by ailments that can be treated. They will live in pain from diseases that otherwise will not degenerates, and too many legislators don't seem to care. This is not what America or good government means to me. In America, we help each other, like the mayor and Get Covered NYC helped me. That is what you call government of the people, government that helps all the people, not just those who can afford it. Thank you very much.
Thank you. Well done. Thank you very much. Now, my pleasure to introduce the proud representative of Flushing in the City Council, and he is a strong, strong advocate for the community, Councilmember Peter Koo.
Thank you, Mayor de Blasio. Mayor de Blasio is the people's mayor. No, that's why he is in Flushing. No. And I want to thank First Lady and President Ng of Charles B. Wang Center, and EDC President Assemblyman Wang Kim, and my colleague Kobe Johnson here. I moved to Flushing 30 years ago, and it has changed a lot. No, Flushing is one of the most dynamic, most vibrant town of New York City. Just ask the property owners how much tax they pay, then you will know this is a very vibrant place. Because vibrancy, everything go up, right? Rent go up, everything go up, tax go up, but it's good. The city has money to pay for all these services. So I want to say we are very lucky we live in Flushing. This is a destination of choice for many, many Asian Americans, whether they're from China, Taiwan, Hong Kong, anywhere in the world. The first choice is when they want to move to the East Coast, they move to Flushing. I want to thank the mayor and the city council for supporting Charles B. Wang Center for the construction of a new healthcare building soon to be built around College Point Boulevard. Once this is built, it will help the local community a lot in terms of healthcare. We all know healthcare requires linguistic and cultural support, especially mental health care. You know, when you have mental disease, if you don't speak the language, it's really hard to communicate, and the doctor doesn't know how to treat the patients. So I applaud the First Lady for always trying to do something in terms of mental health care. Mental health is the basic cause of a lot of social illness. You know, domestic violence, homelessness, alcoholism, drug abuse, all related to mental health. So Charles B. Wang Center has a very good mental health service for local immigrants. For many local immigrants, it's a shame to mention about mental health. If they have cancer, everybody understands. So when they have mental health, they are worried. You know, they don't want to say it out because somehow they think it's a shameful disease. But actually, it's not. It's not their fault to have mental health. So I hope our community, everyone will stand together to tackle mental health. Once we solve mental health, we solve a lot of other social illness, social problems. So in conclusion, I want to thank the mayor and everyone here, and I want to thank EDC and, of course, our city council for allocating more than $1 million. I forgot the exact number. It's $1.something million to support the construction of this new building. Enjoy the day. Thank you.
Thank you very much. And representing this community in Albany, and I want to thank him because he's been an important ally for so much of our agenda in Albany and helped us get a lot done for the people of Flushing and the people of Queens. Assemblymember Ron Kim.
I never know if I should step on or step off because I'm like 5'9", so I'm just at that cutoff whether I should.
You're even bigger
I'm
now.
even bigger now. Okay, taller now. Thank you, Mayor. So 2 weeks ago, I was with a constituent just a few blocks away, a 75-year-old woman, stage 4 cancer, living by herself, no family members. She has 2 nieces that's unwilling to help, $37,000 in debt. $37,000 debt. And she lives in fear every single day that the Republican president, Republican Congress will take away her health care. She lives in fear of every single day, just like thousands of others in this district and throughout the city. We're going through the same exact struggles. Just yesterday, Mayor, I was with another family who lost a son to opioid and heroin addiction 2 years ago. And I found out after speaking to him a few minutes, there were two other families in the same block who actually lost their children as well in the last 5 years due to addiction. So there are so many different types of health-related issues that we should be doing more, not take away. So for those reasons, I thank the mayor, the chair of health, our partners in government for stepping up while our federal government is trying to take away services every single day. So thank you, Mayor and First Lady, for all that you do. For me, Charles Wang is very personal. You know, I'm in Albany 6 to 7 months a month, but I have a 3-year-old and a 1-year-old daughter, Olive and Hazel, and this is the place where they get their primary care. And no matter, thank you. And no matter how busy I am in Albany, I try to make it back because I've discovered none of our parents or my wife want to hold on to our babies when they're getting the shots. They leave that up to me. So I need to be here whenever our kids get their shots. But I raise that story because I try every time to be there with my daughters, because whenever I come through those doors, whether it's 9 a.m. or 5 p.m., the lines are packed. The elevator at 8:30 a.m. starts to get packed in this place. And there are people waiting upstairs trying to get served. So that is why we need that College Point facility. We need to expand Charles B. Wang. And I'm so grateful that all of us are coming together to fully fund this initiative because this community deserves a lot better. Thank you so much.
I admire you, Assembly Member, for taking on that role in your family, holding the children during their shots. That's not for the timid. Good for you. Finally, key ally in all we've been doing in the City Council to focus the city more on community-based healthcare, primary care, preventative care. I know these are all mantras for the chair of the Health Committee, Councilmember Corey Johnson.
Thank you, Mr. Mayor. Thank you, Mr. Mayor. Thanks for having me today. I want to thank the First Lady. I stand here today as a New York City Council member. My name is Corey Johnson. I stand here as an openly gay man. I stand here as someone who is HIV positive. I stand here as someone who last Thursday celebrated 8 years clean and sober from drugs and alcohol. I stand here as someone, as chair of the Health Committee, who doesn't have a medical background, but at certain points in my life, after I became HIV positive, qualified for health insurance, didn't qualify for health insurance, could afford my COBRA payments, could not afford my COBRA payments, qualified for the AIDS Drugs Assistance Program, didn't qualify for the AIDS Drugs Assistance Program. And during those difficult times, what I relied upon was community-based health that was culturally competent as a gay man, that I could go to and have a safe place to actually talk about my healthcare needs and get them met in a culturally competent and appropriate way. And that is what this is about today. That is what expanding healthcare access is about. I mean, it's been said, I think it's important to repeat, while Republicans in Washington and the president are trying to take healthcare away from over 20 million people, New York City, we're investing in healthcare. In New York City, we're expanding healthcare. In New York City, we're creating more access to healthcare by opening up sites like this all across the city. This is one site we're looking at, but I also think it's important to talk about the record that the council and the mayor have over the last 3.5 years. The previous administration, the previous mayor, I think got some good credit for being a public health mayor and for investing a lot in public health. But this administration has done a tremendous amount as well. They have added, as chair of the Health Committee, hundreds of millions of dollars to the Department of Health and Mental Hygiene, investing in healthcare access for all New Yorkers. Councilmember Koo has been a huge champion with Charles B. Wang of expanding access and treatment on hepatitis B and C all across the city, which afflicts people of color, especially in this community. And we've done that in HIV and AIDS. The First Lady has done that on Thrive NYC for people with mental illness. We are expanding access all over the city. And this administration should be proud of that, whether it's come to the Ebola crisis we went through, or the Legionnaires outbreak, or investing in HIV and AIDS, or expanding access to health care in communities where there have been huge disparities in the past. That has been the hallmark of this administration, and that has been the hallmark of this city council. So I'm really grateful that the mayor is doing this in this really important community and neighborhood across the city. Charles B. Wang has another great site in Chinatown, which serves a really diverse population down there as well. And when I found out I was HIV positive in 2004, 13 years ago, and I lost my health insurance 2 weeks later, and I did not know what to do. I went to a community-based healthcare clinic called Apicha in Chinatown. And Apicha is what connected me to someone who got me connected to the AIDS Drugs Assistance Program, who got me a caseworker, and I got case management, who connected me with a primary care doctor so I could get my health care needs met. This administration has been investing in organizations like Charles B. Wang, like Apicha, and like other organizations that are connecting New Yorkers like myself to the care that they need in times of crisis and in times when they just need a regular checkup. So I stand here today as a proud New Yorker, proud of Mayor de Blasio, proud of the First Lady, proud of the mayor of Flushing, my friend Peter Koo, in fighting for this community and getting more people the help they need. This is a great day. Congratulations. Thank you, Mr. Mayor, for having me today.
All right, I want all of the folks up here to gather around these photos so we can get a shot of this wonderful news center.